And some people are collecting their audio system. All right, so I will introduce myself shortly. I'm working as a family doctor in the Netherlands. And 19 years ago, actually my training in family as a family doctor started also with encountering here in Albagnano. So I'm trained as a family doctor, but also trained in the aspects of Buddhism by Lama Ganchen and Lama Michel. My background is actually, if you speak from a more religious point of view, coming from a Jewish Catholic background. So I was not having anything in a background of Buddhism, but it touched me a lot. And I had the opportunity, together with Rogier, my husband, to travel a lot with Lama Ganchen and Lama Michel to many, many different countries. We did many pilgrimages and also went to many conferences. And all this created new insights for me. And one part of my work is focus on lifestyle medicine. And the other part is also a part that I like to work on a lot is palliative care. And as we all know, cancer is a huge topic within palliative care. Tomorrow I will talk a bit more about that. But today I'm going to share with you some aspects about lifestyle oncology. And Paula did already a very beautiful and good job to explain some mechanisms in relation to oncology, because it's very, very, very complicated. My lecture will be more on the lifestyle and also on solutions, what we can do. So besides my work as a family doctor and specialization in palliative care, I'm also working as an acupuncturist in Tibetan medicine. So just for your information. I thought to start with a small quiz. Also, it's a good refreshment for this moment. So my question to you is, what is the percentage of cancer that is hereditary? 50. 30. Who would say less or more? Less. And you 10. All right. So you cannot make any mistakes. It's just a quiz. 5 to 10% is hereditary. And often patients, but also doctors, we think it's far more. In fact, 67%, almost 68% of patients believe that cancer is a hereditary disease. Why is this difference so big? Because one of the reasons is that doctors often ask to the patients, if they got diagnosed of cancer, do you have in your family also a diagnosis of cancer? This makes immediately the thinking, okay, so cancer is a hereditary disease. But out of a lot of research, we have found and can see that the real part that there is a genetic defect and that is the cause that creates cancer disease is really small, 5 to 10%. It is true that cancer always arises from a gene defect, like Paula also was explaining before, that there is happening a lot why a disease like cancer can occur. But it's important that to know this point. Then my next question. Oh, I go back. Sorry, you saw already some answers. Anyhow, what percentage of cancer is lifestyle related? And before you saw the answers, what do you think? Is it a lot or just a bit? Percentage. You already saw if you were awake. Anyhow, I'll show them. These are the answers. So lifestyle in relation to cancer, depending on what you account to lifestyle, is 30 up to 50% related to cause of cancer. One very important part is that some people say, oh, is it my own fault that I got cancer then? No, cancer is so complicated. It's really, really something that many, many factors come together. But yes, lifestyle is a very important factor in this sense. Then overweight. We know overweight also has a relation with disease of cancer. What do you think is the risk factor in this sense of overweight? And that people know overweight is in relation to cancer. 70%? 30, yes. 30% of the people think that obesity has a relation with getting the disease of cancer. But how many people have overweight in the world? What do we think? 25%? Yeah, 25 more or less, everyone agrees? Okay, it's shocking, but 38% of the world population is overweight or obese. And that's 2.8 trillion people. And they predict that just 10 years more or less, we are up to 50%. So we are heading up to a great disaster together. And as Michelle was explaining this morning very clearly, is we know that some things are not good for us, but how we can change. All right, so the depressive part of this lecture, we will finish soon, okay? But just to share some more information, because I think it's important that we understand very well in which situation we're in now. These dark blue spots you can see are the places where the amount of cancer is the highest. What do you think could be a reason in relation to these parts of the world? Why it's there more than other countries? More rich? Yeah. Yeah, environments, more sun, yeah, possible. Sorry? Longer? Yes, possible also. Yes. Less diagnostics, also, yes, it's true, yes. Yeah. What we see in general is that first is there is increased longevity, especially also in the industrialized countries. We have more early detection, more effective treatments, but also we have an unhealthier lifestyle in these industrialized countries. And as we could see before, up to 50% of the cancers are related to unhealthy lifestyle. So we have some things to do. If we look to Italy, maybe Italy is not showing up. Yeah, here it comes. This is the current state in Italy that on the total population are the new number cases of cancer. And in different countries, the different type of cancers is a bit different compared to, for example, Holland. But in general, we will find these numbers in these industrialized countries. Here in Italy, it's better than in Holland, I have to say. So here in Italy, people are dying out of cancer, 1 out of 3 for men and 1 out of 4 for women. In Holland, now we have the diagnosis of cancer in the Netherlands in one lifetime is 1 out of 2. It's incredible. So 50%, and it's equal for men and women. So this is where we're heading to, and we're already in. So very worrying numbers. But just before I go to the solutions, just to share one other big worry that recently they found out, and in a huge research, they did a research from 1990 until 2010, and now they repeated this same research until 2019. And what they see is that first we thought, okay, cancer is more for people who are the elderlies, no? And also because of the better treatments, they live longer. But now we see a new trend, and that is that younger people have more cancer. So and also the middle and the higher classes in the society have more cancer. And this is for the first time that we see this. And also these are the risk factors that are related to it. So diet high with red meat, low in fruits, high in sugar intakes, and the alcohol and the tobacco are the reasons for it. And the vaping is a very worrying development at the moment. So the tobacco industry has been very smart. So they made it popular to do something else instead of smoking. So for the first time, we see this kind of, let's say, yeah, there it goes. For the first time, we see this kind of results, that in the upper and middle income, the amount of cancer is on the rise. And compared to 1990, there is an increase of 58% of cancer diseases in this specific group of 15 to 39 up to 40 and 45 in age. And even for the younger population, we see this rise. So these are just the facts that we have to do with, and I think it's good to start with. But as I'm here now for 20 years, coming here, I really thank the lamas for always looking for solutions. So when I started to study as a family doctor, I spoke with Lama Garnchen about what I saw in my medical training and also becoming a doctor. And then Lama Garnchen was saying, look what is lacking, where are the solutions, what is the trouble, and look for solutions. So I like to focus now for the second part of this lecture on the solutions. And I'm very happy that he could show me. So let's see, what are solutions? As we know, this 50% of cancer is lifestyle related. I think one side is confronting for us, but at the same time there's hope. No, we can do something, we can change. The World Cancer Research Fund, they did a huge work to collect all the data worldwide. Each 10 years they reproduce this research, and again and again and again, they see that nearly 50% of the most common cancers can be prevented. So this is good news. But we can do something about it, because until now, the amount of cancer is only increasing. For the ones who are more interested in details, this is a very important expert report was made on lifestyle changes in relation to cancer. So you can easily find on internet. And what do they summarize? No, they say obesity, poor diet, and lack of physical activity are all linked with clinical outcomes in cancer. Exercise has been shown to improve the anti-tumor immune response and survival. Palamuti focused on the mind-body techniques. Exercise is another one. We can improve the diet quality and gut microbiome and to reduce the risk of cancer. If we are more active, the quality of life of all of us, but also for the people who have cancer, increases. But if we have more overweight, it's more hard to reach these benefits. So just to show you a little bit more how they developed this World Cancer Research Funds, they made very practical entrance to get also a lot of background for non-professionals, because I'm talking here as a medical doctor, but it's good to know for all of us to go through this. So it's very easable, accessible, and understandable. And you can see for each type of diet what you could do. For the ones who are also interested in some more background, I brought some books. For example, Eat to Beat the Disease, very interesting. It's also related to the presentation that Paula gave on all this background, why food can be of importance to re-strengthen immune system. This one, Healing with Whole Foods, is a very interesting one that is integrating Western perspectives with traditional medicine. And also, here's another one, live well, live long. So many different possibilities to get some more insights in this topic. Okay, so lifestyle factors. What are the lifestyle factors? I already mentioned some of them, but you can see tobacco, of course, and actually vaping is not written yet. Overweight, pathogens, so viruses. All different type of virus can cause cancer. A lot we still don't know. Then we have the physical inactivity, the way we eat, also how fast we eat, the nutritious amount of food that we eat. Fast food, of course, we know is related to also to cancer. Then an important one is the jobs that we do, because we're in artificial light, or we are in relation to painting, and for example, that create toxins. So there are many, many ways we got exposed to lifestyle factors. Some are in our, we have control about it. Some we don't have, but at least it starts with understanding. Okay, what are the lifestyle factors then that influence us and can create cancer? It's important to know this is not like, okay, I was painting my house and tomorrow I have 30% more risk in cancer. This is not the case. It is always important to understand, okay, many, many, many different factors together make that cancer can develop, and it's often something that takes years and years and years and years. Our current, the solution that we have at this moment is that we have to do more research or screening to prevent us from cancer. Also what we're now trying to do with the cancer medication, that we focus on, for example, DNA, and in that way we can treat the cancer in a more precise way. It's of really great help. It will reduce costs. But if we know at the same time that we can reduce 50% of the cancers just by our lifestyle, and if we compare that to, when I was studying doing my training in medical care, I did not get anything about diet and lifestyle in relation to cancer up to now. So I think we can do a lot of things in relation to that. So screening, it will not take us out of this pandemic, unfortunately. Just to say something more about that recently, for example, in Holland, they checked that in 2012, the amount of costs in total for all the medications that we were prescribing was 1.1 billion. They calculated it. Nowadays, in 2020, it was done. Now we have a cost of 2.6 billion. And in 2012, 27% of this cost of 1.1 billion was related to cancer treatment. Now, in 2020, almost 60% of the costs are related to cancer treatments. So also we are having a lot of difficulties. We cannot go this way. Okay, so the solutions. One is lifestyle. Just to before I mentioned the lifestyle details. This again, I really want to make sure that I'm clear that cancer is really, really a complicated disease. I'm not going into detail today how many factors can influence the vulnerability inside of our system to get more chance to get cancer. But in this report that I showed you, it's very beautifully and very clearly written, all these factors, how they interact. Okay, so we have environmental factors, we have our lifestyle, the diet, and we have also things that we are exposed to without any control, like the genes that we have and we got from the family, the hereditary, but also the impact of epigenetics on the genes, like Paula was explaining before. And luckily we can influence that part by lifestyle and other things. Okay, so I share with you one solution, and I think, just checking the time, if we go to for lunch then, and to not to give you not even one solution before we go for lunch. Otherwise, the lunch maybe doesn't taste that well. Okay. So, just this is the short summary of this report that the World Cancer Research Funds made. And actually, it's quite okay. We can, I think, do this. And it's about exercising every day, half an hour. So after this day of sitting all day, we're going to have a walk in the forest. Because practice what you preach, we also need to do by ourselves, okay? So whoever likes to join, today we are also going to do this. Then we need to eat more variety of food. Lots of fruit, vegetables, and rich in fibers. Here, luckily in Italy, you have a lot, so you're lucky. You can easily get access to that. As less as possible of processed food, reduce the amount of sugar, and that's really a challenge because we are addicted to it, and we really, really need to reduce. For me, living here now in Italy, because since 1 year, more or less, I'm living now here in Italy, every morning it's a shock to see the cafe and the sweets that people take, and it's, for me, it's, until now, I cannot yet acquaint with this part in my mind, that this is a habit, no? This is so normal that you have the sweets and the cafe, but both of them wouldn't be the best breakfast to take. So I think at that part, maybe some change can be made. Then also the alcohol, for example, at my work now in Switzerland, is on the border of Italy. At lunchtime, there is Prosecco. And I'm completely at shock because for me, working in the medical field, to open a bottle of alcohol during my work, I never, well, maybe because I celebrated one huge event, but they say, we are celebrating life. Then I said, but I'm sorry. This Mura I learned, I'm sorry, but we are here working in a medical field, no? And we're celebrating life with alcohol. So it's just cultural based, but at the same time we need to be more aware of it. And of course we can work on our weight reduction. So these are just very, very basic aspects to prevent cancer. And the good part is that for the people who have had cancer or are going through a process of cancers, this recommendation is exactly the same. So that's the good part. If you have cancer, you can restart just from here and there, and you have the same chance as everyone else in the sense of to get a recurrence if it's not a hereditary disease. And what they see in relation to people who have had cancer and went through healthier lifestyles, we can see many positive effects that they can reduce. Well, we say we lower even the mortality rates. Up to 6 years, you can extend the life if you do more lifestyle changes, and they have better recovery after chemotherapy, radiotherapy, better physical recovery. So many aspects that can be of help. Okay, I think in respect to the lunch and the stomach, and the people who are creating this nice meal for us, we stop here now, and I will continue afterwards. All right.
Oh. Ah, aspetta, aspetta. Adesso penso che va perché c'è il bumetro che sta piccando qua. Aspetta. Pronto? Ciao? Ciao. Ah, ecco. Sono riuscita. Sorry. Wait for me 1 second. Yes? This microphone is for the questions.
All right.
Okay? So what you need to do is just to...
Ja. Goed. Ja, deze nog. I think we're still missing some people, but I think Paula is there. All right. Yes. This is not the most easy part of the day after the lunch. We like to have a nap, but I'll see if this can be a juicy second half, like a dessert, okay? We wait just 2 more minutes and then we start. Sì, sì, è qui. Io parlo in inglese, ma il mio collega si parla in italiano, no, è simultaneous. Sì. Sì. Per inglese adesso è in italiano, dopo quando è parlato in italiano la translazione è in inglese, vice versa. Quindi adesso la prima parte è prima in inglese, sì. Ok. Right. Okay. I will start slowly. People will come in. So just to make a very short, small summary, we have had the bad part that we know that cancer is related to a lot of different aspects in our life, related to lifestyle changes. And now we're in the second half to see how we can create solutions in this sense. So integrative medicine is also, I think, part of the solution. Who knows what is integrative medicine about? Who has heard about this terminology? Can I see some hands? No? Two people? 3, 4? More or less 5, 6. Okay. I'll just say shortly that integrative medicine is developed, you could say, in America. John Kabat-Zinn, the one who started with the mindfulness training, he came into a board of doctors to look how to solve problems that we're facing in healthcare. And they developed a new perspective how to look at diseases and also look at solutions. And they started a consortium inside of hospitals to work on solutions to see how to treat a disease. And these are based on different aspects. So this is the definition that they created already in 2004. It's a practice of medicine that reaffirms the importance of the relationship between the practitioner and the patient. It focuses not only on one part of the disease, but on the whole person, the social aspect, the spiritual aspect, the physical aspect, the mental aspect is informed by evidence and makes appropriate use of all appropriate therapeutic approaches, healthcare professionals and disciplines to achieve optimal health and healing. So also other approaches were allowed based on evidence or at that moment what could be the best for the patient seen from that situation. This was a starting point in the hospitals. Nowadays, there are 76 academic centers connected to this movement, not only in America, but worldwide. And integrative medicine is in different fields now developed also in the field of oncology. So I mention here just 3 of them. Big centers, Memorial Sloan Kettering Cancer Centers in New York, MD Anderson is in Houston in Texas, and also we have in Boston Dana-Farber Cancer Institute. Some of the slides that I was showing earlier came from Lorenzo Cohen, and he's the director of the MD Anderson Cancer Center. We met just recently 3 weeks ago in Rome. And he was having very inspiring talks about the movement of integrative medicine and oncology. And I'll show you just a little bit what they are doing in these centers. So I showed you all the things that we can work on, no? On diet, on exercise, on a psychological approach, but how to do. And they collected all the data of evidence that can be adjusted for cancer patients, and they start to build it inside of a program. So there is a focus on diet and nutrition. They advise people to sport. They do mindfulness in their clinic, yoga, tai chi, and qigong. They give massage, also aromatherapies. They work with music or creative and dance therapy, acupuncture, and you can hardly see, but also it's written herbs and supplements. So inside of these integrative medicine clinics, they offer this type of treatments. And some people will say, but is there evidence for it? Because still we are in a medical field and we cannot do whatever we think is nice or feels well that we can add, because we really are working on to improve the quality of life, reduce inflammatory levels. And so they did a huge overview of all these therapies in this sense to breast cancer. And they said, okay, all the therapies that they are doing in these clinics and the recommendation that were put in also inside of the guidelines are based on clear, thorough, and relevant scientific evidence. So this is good to know that it's based on this background. So Paula already mentioned in her lecture the effects on all the small parts in our body of the transmitters, the neurotransmitters, and these is a summary of recommendations that they are giving in these academic centers. And so, for example, they have music therapy because they know it reduces anxiety and stress. It reduces depression and mood disorder if people do yoga and meditation, all the things that also Paula was showing. There they do it in practice. And also, for example, for the people who are having chemotherapy, they get acupuncture to reduce the side effects of nausea and vomiting. And one important part that they say about supplements, and I think it's good also to mention here, supplements is not a medicine to take in order to to treat cancer, but it can have a place, but it needs to be advised very carefully and precise. Okay, so this is very basic what they do. They look at the social part, the physical part, diet, how the environment influences a person, how they can cope with stress, and especially also they look at how people sleep. So these are the 6 dimensions in which they work in these centers. Based on that, I also tried to do this kind of treatment in Holland. So I will explain a little bit more about our project in Holland, how we did. But before I enter in that topic, just to mention this integrative oncology, also in Italy they have this approach. And I see you nodding, it's known, this echo. Yeah. Oh, okay, interesting. Huh? So, Bernard? Yes, I have books here and that talks in all the details about which type of nutrients can be in effect. But with nutrients, it's very difficult to say, okay, if you eat this nutrient, it has that effect, because we cannot do a clinical trial by eating all day broccoli and then after 1 year seeing what is the effect of broccoli. But there is this book I mentioned earlier, Eat to Beat the Disease. There's a lot written about all the different aspects about it. Yeah. Due to time, I will go to the last part of my presentation, because I showed the problems, also how they solve these problems in big clinics, no? And I was thinking, okay, can we also do something in a very small form of integrative oncology in Holland, in a primary care setting, in the clinic in which I'm working? And so I will show you a little bit what we did. And we did it also in a form of research, because we really need to see and to, let's say, try to get some outcomes. What is the result? So we did a combined lifestyle intervention. This was diet, exercise, sleep advices, yoga, mindfulness, for improving the quality of life of cancer survivors. And we did a controlled before and after pilot in my area in Holland. So it was an area covering 10,000 patients. And it's a 12-month program. So the people, they start training twice a week, 1 hour of exercise, and 1 hour after that they get a yoga class. And after 3 months, they reduce the amount of the exercise guided by the professional, but they continue doing their sports by themselves. And after another half year, so another 3 months later, they do all the advices by themselves. And the fourth part of the whole year, so the last 3 months, we are only supporting them on distance and to see if all the advices that we gave to them, that they can still cope with it. So we gave them this help on physical exercise, mind body therapy, dietary advices, sleep and psychological support. And also we looked at each person, of course, have own troubles. So we really looked at their personal needs. And we use different methods, let's say, to see how they're feeling. So we work with acceptance and commitment therapy, positive health, and I'm wondering, positive health, is this something that is known with some of you? What is this about? No. I made some copies because it can be interesting for, especially for you in the psychology, oncology field. This is created by one lady called Magda Huber. And she's a family doctor in Holland. And she did a thesis on the question, what is health and what is sickness? And because we're still using one definition of health, from the WHO from 70 years ago. Paula was mentioning it, that a disease is in fact an absence of, the health is an absence of disease. No? And she was wondering if this definition was still valid, if there is not a better way to look at what health is. And then she mentioned, okay, she did an inquiry in the population of Holland, and to ask people, what is for you good health? What are the ingredients that are part of good health? And then she found out that the people were mentioning 6 domains that they said, okay, for them, this is part of good health. And this is about how they feel physically, but also how they feel mentally, also about spirituality, quality of life, how they participate in society, and how they do in daily actions. And we use in our program this way, that they give a number, 0 out of 10, and you make a web like a spider. And then the people can see in which part of their life they're lacking some attention. And then, even though, for example, they are having a lack in one of the dimensions, still we ask them, for the person themselves, what is for you important to make your change? And sometimes it's interesting that they give a 2, for example, to spirituality, and a 6 for exercise, but they start working on exercise because for them at that moment is the most important. So it's important to follow what their wish, what they think at that moment that's important for them. So really make a personal needs map for them, how they can work on their lifestyle. And also it's helpful not to start with everything at once, but just to choose one topic. So if you're interested, you can find it there. Anyhow, so we do the positive health. Kaizen means small steps. We give a lot of information evenings about diet, how they can make their changes, advanced care planning, coaching, and also spiritual assessment. These are the inclusion criteria. So of course they're oncology patients, and they're curative treatment or with a life expectancy more than 12 months, and diagnosed shorter than 2 years, but the longer than 6 months. This is the window that we use for our research. The reason why we did like this is based on healthcare insurance program in Holland, and we looked at all these troubles that they could have. And as I mentioned, we use this spider web to check how they felt and what they want to work on. And what we found out in this small pilot was very interesting. I think even though it's a very small pilot, I'm not going into huge, big detail, but I think the most important part for us, what we found was that on the left side you see the intervention therapies that we did. On the right side, the symptoms that they were experiencing. And over time, we could see that the symptoms were reducing, either the fatigue or the sleep problems, but they were reinforcing each other. So by doing sports and having a mindfulness program, you could see that the symptoms are also influencing each other in a positive way. So this is also a conclusion that they found in the MD Anderson Cancer Clinic, that if you give one solution for one problem, it helps, but if you add more to it, it will be more cumulative. It is still a hypothesis, but also in the MDC and the Cancer Clinic, they're referring in the same direction. So we need, of course, more research doing on this, but it's an interesting first start, and that we could see that the quality of life in total was increasing. We use a lot of questionnaires in order to understand, well, what's happening with the patients over the time. These are the questions that we used. And these are the outcomes for this small study that we did recently. And I think due to time, I will give you the short summary. They were satisfied. Most of them could follow very well the whole program. We gave 3 months of relaxation, but most of them wanted to have more of it, so it was not enough. And they gave high rates in satisfaction and overall attendance. So we will make a new RCT. This will be the next step to measure the effects of this type of program. But I wanted to share with you that even we have seen in big hospitals they can give big programs, but even also in the smaller settings like primary care setting, it's possible to start with help for cancer patients. And then it was actually a coincidence that Yvonne is a good friend of ours from here. We know each other for many years. And you recently went through cancer diagnosis and also treatment. And you did actually this type of approach by yourself. And I think it's a beautiful opportunity just to hear from you in person a bit of your experience. So I'm very happy. It is a coincidence that you're here. But just finishing this talk, I would like to give you the floor and give you the mic just to share how you went through it. I have to press quite.
Let's see.
Yeah, it was said that I have to put longer time.
There. Yeah.
So wait. Mm-hmm.
We need you.
Maybe she mentioned just to do. Here we go.
Hello?
Yes, here you go.
It works. Yes, very close. Okay. How much time? 5 minutes. 3 hours. I have stories I can share. Unfortunately or fortunately, 5, 10. So maybe I stand here. Yeah, my name is Yvonne, and nice to meet you all. And I'm with Rinpoche in this center since 2007 because I love mindfulness, meditation. My job is in clinical research. I work in a big pharma environment, doing clinical research since 30 years. And then 2014, I experienced my first breast cancer diagnosis. And being here, knowing Elkanah already, also Rinpoche, helped me to understand what I can do to go through this. And I have a family history. Unfortunately, at least 3 women from my mother's side passed away very early with breast cancer. But I was still kind of shocked when I got my first diagnosis. And Rinpoche gave me advice, Elkanah, to say, okay, you go through your medicine therapy, and at this time it was early onset. I didn't need chemotherapy, but radiotherapy, 2 surgeries. In 2014, I started to change my lifestyle. Even I was always sporty, I rarely ate meat, didn't smoke and all the stuff. However, I was diagnosed and I still learned I can do a lot myself. So since 2014, I started to run every day. One day, pause and walking, but I'm outside in the morning. So I have 5 areas which I changed. The running and exercising early on in the morning. Nutrition, I skipped all meat, changed for dairy products, have green tea, cranberries, and there's a lot in these books you can learn, and I learned to integrate these foods into my life. The third one, since 2014, I do everyday self-healing meditation. I did it before, but not every day. So that's kind of the third element. And the fourth one, vitamins and some kind of Chinese medicines prescribed and advised by doctors. I don't just take stuff myself. And the fifth one, I eliminated emotional difficulties and challenges in relationships. I started to learn more setting boundaries. So I thought, well, I'm good. So since then, I'm happy and live healthy in a way, changing my lifestyle. I have a stressful job, but I like and enjoy. It's not something where I say, okay, it's too much of it. And then what was too much for me since 9 years, every 3 months, every 6 months, then once or twice a year, mammogram. And always this big question, does cancer come back? It's a lot of fear going through the doctors and hoping, oh, nothing comes back, nothing comes back. This year in February, my other breast was affected, and so it came back. So the fear came true. And I was in Nepal that time, in Kathmandu, with Lama Michel and Elkanah and others when I received the diagnosis, or the confirmed diagnosis, and some advice and strengthening was given to me, saying, okay, it's manageable, you know what to do actually. But this time it was HER2 positive breast cancer, still early, but that meant chemotherapy. And so mid-March, end of March, I started 6 cycles of chemotherapy with carboplatin, Taxotere. I don't know if people know the therapy, but it was not a mild one because I have the second occurrence. And then the antibody therapies of pertuzumab and trastuzumab. So the full therapy I could get. And continuing what I learned, my 5 principles. So first, therapy. I also learned to add some, other elements. I started to do acupuncture. I visited a Chinese doctor in Basel. I'm close to Basel, Switzerland. And so just starting the journey. We always talk about journey. It's a rough path. It's not really a journey. However, I felt always in peace, and through the practice and mindfulness, and also Lama Michel advising me to do certain mantras. So I was sitting there 6 hours with cooling on my hands and feet and cap to protect some of the hair. Through meditation and mindfulness, I was just always in peace and visualize like, okay, light is coming, healing. There will be days which are not so good, and other days I feel powerful. So I could really go through this from March till beginning of July with all the treatments and antibodies still continuing. Being in peace, could even manage in the first weeks of chemo. The nights are every 2 hours, you're awake and your body is like, okay, there's something. But doing with the mantras and some of the areas which I learned, I could cope, I could accept. And at the day 2 after chemo, I started running like this, but I started. I was with my friend who is here with me. Every day she motivated me to run with our dogs, so slowly but surely I could always run. And this was fantastic, After running, I felt almost like, oh, I'm good, I'm normal. Then it kicks in, the side effects. But slowly but surely it was really working through. I didn't work for 1 week after chemo because my mind and all the effects hit me quite strongly, but I accepted and went through with all my 5 principles, which I could continue. And then week 2, week 3, in each cycle, I started working, not full time, but I could work. So, and that was just kind of the path, continuing with a lot of efforts, but I was trained in a way because I did it already 9 years. So therefore I recovered so quickly. My doctor was always like, wow, and my blood levels were pretty stable. They go down and there's an effect, but I could manage that. I didn't need any blood transfusions or anything. And then I had surgery, double mastectomy in mid-August, and I feel liberated and I feel as good as never before, I have to say. I feel almost like, liberated from cancer. And the good news was all the tissue, everything is clean. By now I'm cancer-free. I work since 3 weeks full-time. Again, I continue my path because it strengthened me every day to be in peace. We are all patients. It's not just me. Everyone has something. Cancer, unfortunately, most of us have someone, or even someone here has already also experienced cancer. It's everywhere. We don't know. But I'm very passionate about coming from a scientific environment and pharma environment to combine. I don't say you don't need chemotherapy, and I don't say you don't need these Western medicines, but it's not enough. With a combination, I could come back very strongly, and my body recovered so strongly. After surgery, my doctor said, wow, your healing is like 3 weeks ahead of what I have seen usually. And so I think it's a very complex disease, And it's not just one solution, unfortunately. I wish you give me a pill and then we are healthy. But it's a long path, and it's commitment, and a lot of efforts, what you just showed. And we need to spread that this is the possibility for patients to support their healing, but no promises. I mean, some people do all they can and they still, die or have not a nice progression at all of the therapy. I was also lucky and protected because everything I did really worked out in a very beautiful way, even as difficult treatment patterns. So the only aspect I also want to add, because I know psychology is such a strong dimension for becoming healthy. As a patient, when I'm sitting there or when I'm talking to people, you just need to do lifestyle changes, and then you will be fine in a way. The first thing which came into my mind and I had to overcome is, what did I do wrong? If it's just simple like you do a lifestyle change. So cancer came to me because I didn't do a good life or I didn't do well. And then I compared and I said, no, this is not, there are always little things you can do. And it's all about balancing. Sometimes you do something, you think it's healthy, maybe not, because you didn't balance it well enough. And I wish that scientists and universities teach more and more. Thank you, Paula, for what you do. And we met previously in Borobudur, I remember, because we need to teach that it's a balance and that patients don't feel I did something wrong, because that holds them back to do lifestyle changes. It gives them kind of the guiltiness, you have done something wrong, now we tell you how you do it better, and then you stay safe and healthy. Unfortunately not. Our whole environment is also lifestyle, how we live. And so thanks for letting me speak and sharing my experience. And thank you very much for listening to me.